I'm Dr. Bob Dannenhoffer. I'm a pediatrician and public health officer. This last year has seen the worst pandemic in a century. Over 130 million people in the world have had COVID, and nearly 3 million have died. In the US, 30 million people have had COVID, and over 500,000 people have died. And this COVID pandemic has been especially cruel to women, older people, lower-income people, and people of color. Perhaps most heartbreaking during this whole pandemic has been that hospitalized patients with COVID have been isolated with their families, and so they've not had the comfort of their families in their most desperate and sometimes their final moments. Now, I could go on for hours or days about the negative effects of COVID, and you can find many others who will speak doom and gloom. But today I want to be positive and forward-looking. So that every cloud has a silver lining is an old phrase that says even in the worst of times, we can find some positives. And I found a dozen stories that we'll talk about today, everything from whales to health equity and things in between. Everybody wants to get back to normal, but I would hope that we don't revert to the old normal, but that we learn from this pandemic and that we get to a new and better normal. So whales are magnificent creatures. They communicate over long distances with their low-frequency sounds and their songs. They help to gather, they help to hunt, and they help to mate. But the modern ocean is a noisy place with diesel-driven ships, underwater drilling, and other sources of sound in the ocean. And in such a noisy ocean, whales suffer. It's like being in a 24/7 disco. They communicate less, they don't venture close to shore, and they struggle to hunt. Many whale and orca populations are on decline. We can probably remember back from 2018 where the orca mom Telequa delivered an emaciated baby and carried that emaciated baby on her nose for 17 days, trying to bring it back to life. Whales have more stress, as can be measured by cortisol levels in their feces. Now, you may wonder how you measure cortisol levels in whale feces, but apparently some whale feces float. They float to shore where specially trained dogs spot these and samples are taken. Well, with the pandemic, the ocean's quieted. And in this quieter ocean, whales thrived. They hunted better, they communicated more, and they ventured closer to shore. New York City, which previously had only 3 whale sightings a year, had 300 last year. And New Yorkers were thrilled when a humpback whale such as this breached, not quite so magnificently, in the New York harbor. And the mom Telequa in the Puget Sound delivered a chubby and healthy baby. So when we get back to normal, I hope we don't revert to the old normal of noisy oceans, but we get to a new and better normal where we balance the needs of whales against shipping companies, and perhaps we require noise-free ocean zones, speed limits, or quieter propellers so that the balance of whale needs and the needs of shipping companies can be better balanced. Prematurity in the United States is the leading cause of infant mortality. These babies are born early, and they fill these intensive care units, struggling to eat and struggling to breathe. Now, we have tried to do things to decrease prematurity over the years. We've tried more testing, we've tried more drugs, we've tried changes in diets, and yet prematurity remains stubbornly high. Now, with the pandemic, we were worried that the stress of the pandemic would increase the rate of prematurity, but we found exactly the opposite. Actually, prematurity decreased by as much as 90%, and these neonatal intensive care units previously full of babies were now half empty. Well, nobody knows the exact reason, but during the lockdown, almost all of us got about an extra hour of sleep a night, and it is thought that this extra sleep helped the moms to carry their babies for an extra days or weeks and avoid this amount of prematurity. So, in our new and better normal, I would hope that we balance the needs of these premature babies against the societal needs for women to be working full shifts. So a new and better normal hopefully will have much less prematurity. In another example, pedestrian deaths in New York City are a tremendous problem. Many people die as they dart across the street and people rush to get where they're going. So in 2014, New York City embarked on a program called Vision Zero, that is 0 pedestrian deaths was the only acceptable number. Now, they got a lot of grief for this. It was called an unattainable fool's errand, and they didn't make much progress until the lockdown. But in the lockdown, people drove less, people seemed a little bit less in a hurry, and New York City went 2 months without a single pedestrian death. So then when we return to normal, we hope that we recognize that the needs of pedestrians, and especially the pedestrians who are affected by this are older people, people with disabilities, and people of color, that their needs will be balanced against the needs of other people to rush and drive recklessly. One of the most visible changes during this has been the improvement in air quality. This is Los Angeles, and you can see the murky air in the background. Well, this does not make a very pretty picture, but most importantly, think of the millions of Angelenos who breathe that air in every day. And for many years, we've considered that dirty air was just part of the problem of living in the cities. But with the lockdown, the air magnificently cleared. And this wasn't just in LA, this was in many cities around the world, and the air magnificently cleared. So not only is this a better picture, but think of the health benefits if we could attain this cleaner air. And we can, by decreasing driving, cleaner tailpipe emissions, and perhaps the use of electric vehicles. And driving less is going to be part of this. So in our new and better normal, I hope we recognize that clear air is possible and that we can get there by making some changes. So one of the ways to decrease driving is to decrease these meetings that we all go to. So in the past, we've probably all attended these remote meetings where they have one low-quality phone in the middle of the table, and you can hear all the side conversations and the laughter, but almost nothing else. And attending remote meetings was a painful experience. However, during the COVID pandemic, we recognized that well-conducted remote meetings could be done. And what we've seen is not only have people driven less, but that people who live remotely, who might have to balance the 10 or 12 hours of driving to get to a meeting in Portland, now can attend these meetings. And what we've seen is that participation by people in rural areas has tremendously increased. For me personally, it saved over 20 hours of driving and over 1,000 miles each month. So we hope that in our new and better future, that these remote meetings are actually the norm, and that we only meet in person when we actually have to, and that by doing that, we can save gas, we can decrease pollution, and we can get the cleaner air like we'd like in Los Angeles. This country has had an obsession with perfect attendance. Many schools give perfect attendance awards, and businesses give awards for not missing work, and they don't have sick care or sick time off so that people go to work or go to school when they're even sick. Well, this year, with masking, distancing, and staying home with you're sick, we have seen a 99% decrease in the amount of flu, strep throat, and respiratory syncytial virus. Now, the reason we've seen that is because masking and social distancing and staying home when you're sick works well for COVID, but works really well for these other diseases, and we brought these diseases way down. So in our new and better normal, I would hope that our society recognizes that people getting sick is not a good thing, and that perhaps workplaces will have mandatory sick leave, and schools will give perfect infection control awards rather than perfect attendance awards. One of the truly great parts of this pandemic has been the development of the mRNA vaccines. So mRNA vaccines, which are in the Moderna and Pfizer vaccine, are truly remarkable with over 90% effectiveness, and they're incredibly safe. Compare this to our previous flu vaccines, which were probably 50% effective. Now, the flu vaccines are based on technology from the 20s. Well, that's the 1920s. You take millions of chicken eggs, you inject the chicken eggs with the virus, you grow that virus, collect the virus, kill the virus, and use that for the vaccine. A long, complicated, and not very effective process. Now, mRNA vaccines have been around for about 20 years, but they made almost no progress because vaccine funding had been chronically underfunded and not prioritized. Well, with the COVID pandemic, we saw that vaccine was probably our best way out of this. And with our best way out of this, a lot of money and a lot of effort was put into it, and Operation Warp Speed was begun. Well, the development of these mRNA vaccines proceeded at pretty much warp speed. Now, the good part of this is that these mRNA vaccines can be made against any genetic material. So imagine a vaccine against HIV, a vaccine against herpes, a vaccine against MRSA, a vaccine against hepatitis C, and because it can go for any genetic material, you could even imagine the development of vaccines against cancer. And so in our new and better normal, I would hope that we put vaccine development to the forefront so that we can prevent many of these diseases, hopefully including cancer. Now, the healthcare system has had lots of changes during this time. So early on in the pandemic, we could all remember the pictures of people with inadequate personal protective equipment, either reusing masks or jury-rigging things. How in our society could we have had the heroes in our ICUs work without the proper protection? 3,600 healthcare workers died in the pandemic, mostly due to the lack of adequate protection. These are the PAPRs here that provide nearly 100% protection. And how could it be that every worker didn't have one of these as soon as we started? So I hope in our new and better normal, we learn that everyone who's brave enough to work in the ICU should have one of these hanging on a hook, charged and ready to use when their next infectious patient comes. Well, in healthcare, we've learned other things. So previously, visits in healthcare needed to be conducted in person. Rules suggested that visits by telephone or by video were not effective and not allowed to be used. But during the beginning of this pandemic, we recognized that bringing well people into an office where there might be sick people and exposing them to COVID was not a good idea. And what we did was we allowed the use of telehealth visits. Well, these telehealth visits have been truly remarkable. In my experience, they're almost as effective as visits in person. They protect people from disease, and for many patients, they're preferred because they're much more convenient. So in our new and better normal, I would hope that we continue to do telehealth, we continue to allow to do telehealth rather than relying on antiquated rules, and so that we pick the kind of visit that actually works best for the patient rather than just simple following the rules. That would truly be a new and better normal. One of the other things we noted was that during this pandemic, 22 million people lost their jobs, and 15 million people lost their health insurance because their health insurance was tied to their jobs. Now, other countries have had similar magnitude of job loss, but they did not have the health loss because their health insurance was not tied to their employment. Now, some people were able to get other insurance, they were able to get on Medicaid, but nonetheless, they had tremendous disruption. So what I hope we learn from this pandemic is that tying health insurance to job means that every catastrophic job loss is now accompanied by a catastrophic loss of health care. So we would hope in our new and better normal, we can figure out a way to disentangle these so that a job loss is not accompanied by a devastating loss of health care. And finally, health equity has been something we've talked a lot about in healthcare. We know that poor people of color have much worse health outcomes than others. And in the past, people have blamed this on poor decisions by poor people, or a lack of caring about their health care, or if they just eat a better diet, they would do better. Well, this pandemic has laid bare the health inequity. So this is a map of New York City, and you can see to your right Brooklyn, where I was born and where Dr. Fauci were born just a few miles away. The hospital I was born in, Wyckoff Heights Hospital, was the epicenter of this pandemic. And you probably saw it on TV. This was the hospital that had the row of refrigerator trucks out front to collect the dead bodies. Now, Brooklyn is one of the most diverse places in the world, has people of all income levels, people from many countries, and they suffered mightily. Yet 10 miles away on the Upper West Side, a mostly white and affluent area, they suffered much less. Their hospitals were open, and they certainly didn't need refrigerator trucks to collect the dead. So I would hope in our new and better future, we recognize that these health inequities are not due to poor choices by people who happen to live in Brooklyn, but structural problems that lead to this health inequity, and that over the next decade, rather than just continuing to argue whether health inequity exists, that we actually work on fixing this. So I think we're nearly to the end of this pandemic. Vaccines have been very effective. We've seen declining rates in the United States, and I hope that we continue to see declining rates and that we will get back to normal. But when we get back to normal, let's not accept the old normal, but let's have a new and better normal where whales thrive, where there's less prematurity, fewer pedestrian deaths, safer places to walk, where healthcare workers are protected, where health insurance is not tied to your job, and where we start actually making some progress on reducing our health inequities.